A feel of why everybody's here. Who is here because they have dizziness? Anybody who's having dizziness or vertigo?
You call it dizziness and stuff? Sometimes
Yeah.
I'll just be standing there.
Anytime, like if you feel like you're spinning or the room's spinning,
It's not
or
spinning, I just kind of, like, not stable.
I have a headache, but it's not regular.
Isn't that what this is for?
yes, ma'am.
Okay.
Yes, ma'am. How about has anybody had a fall and has fallen and wants to make sure that doesn't happen again?
You fell yesterday.
Yes.
Oh, yesterday. we're a day late. And how about just generally feeling off balance and unsteady? Okay. Does anybody fall into the none of the above category, but I just don't, I want to make sure that I don't? Okay. Very good. Well, I have seen people, I've been a physical therapist for 13 years, and over that time I've seen people at various different places on that continuum. For a long time I primarily worked with people who had already fallen. I worked in a rehab setting, and I worked with people to get them back moving after they had had a fall, after they had broken a hip. A lot of those I saw, unfortunately. And when I came to work in an outpatient setting, I wanted to try to catch people before they had those really bad falls. And a lot of people assume that falling is an inevitable part of aging. That as we get older, we just naturally get weaker, we naturally are unsteady, we lose our equilibrium, and our bones get weaker, and just at a certain age, you have aches, you have pains, you have falls, and when you fall, you're likely to break things. And a lot of times when we go to the doctor as we get older, the doctor will even tell us when we have a complaint like that, they often will just say, it's part of getting older, okay? However, I have seen 90-year-olds who are still playing golf, and I have seen 60-year-olds that have broken a hip and are in the nursing home. So, although the body changes as we get older, I strongly believe there's a lot that we can do to influence how our body responds to aging and to work against the negative effects of getting older. Because we would all rather be that more active 90-year-old than obviously the just retired, or at 60, most people haven't even retired, who is having falls and fractures and problems like that. Okay? So, if you got one of these, did anybody not get one of these? Maybe Trevor can grab you one if you didn't get one. But this is a framework that I like to use to address how we can prevent the falls, the fractures, the unsteadiness, the dizziness, and all of those problems that is really the biggest complaint that we hear from people as they get older, and really primarily affects, maybe second only to something like back pain, affects people's ability to keep doing the things that they enjoy doing. And that's really most important. We don't just want to be strong to be strong. We want to be strong so that we can do the things that we want to do, so we can go the places we want to go, so we can drive a car, so we can work in the garden, so we can play with grandchildren. I mean, that's really the goal here, okay? So the acronym is STRONGER. So the first S on there is self-assess. So we really need to be aware of how our body is changing. Someone commented to me earlier that it's like you just wake up one day and you're not as strong as you used to be. And really, it might seem that way, but actually at the age of 35, your muscles start to decline. Okay, so you start, if you're not doing anything to improve your muscle strength, you're actually losing muscle strength. Okay, so me, I will be 38 next week, and if I don't do anything to actively increase my strength every year, at every birthday, happy birthday to me, I will lose muscle strength. Okay, so it's not something that just all of a sudden happens when we turn a certain age. It's something that slowly happens over time that we can then slowly work towards. Okay, so self-assessment is just being aware of how you're doing, and on the back there's actually a self-assessment as far as activities and things that you can do to help stay strong and active. And you might think some of those things are like, oh, well, I couldn't do that. But I promise you that no matter how strong you are, how mobile you are, or what level of activity you're able to do, any of those things can be modified so that you can participate in them and get stronger and keep your strength up. Okay? So that's just a kind of a self-assessment to see where you are. The other thing specific to balance is the single limb stance test. So it often surprises people, people even who feel pretty steady on their feet. I know we did this with Trevor's mom a while back. She's active. She's in the garden. She has like 6 dogs that she takes care of, and super active lady. And when we did the single limb stance test, she didn't pass. And so passing the single limb stance test means you're at less risk for having a fall and losing your balance. Okay? So that's just something, if you get in the habit of testing yourself and seeing where you stand, on a regular basis, every couple of months, you'll notice a change before you have the problem. So sometimes we don't notice that our balance is declining until we actually lose our balance and fall. Whereas if we can catch it before then, we can do things to improve our balance. So like we were talking about strength, just like, if you want a strong bicep muscle, you could put a weight in your hand and do bicep curls and make your muscle stronger. The same is true for balance. That there are exercises that you can do to improve your balance and make your balance stronger, just like any other muscle in your body. So it's not, like I said, it's not inevitable that the balance just declines. All right. So the T is to test. So test balance and mobility. And so this is having just a professional perform a balance and mobility test to see where you're having any trouble. And when you do a balance test and there's areas that you can't do that part, that means that's something that you then need to work on. It's as easy as that. What you can't do is something that you need to work on. And unfortunately, we often get comfortable and just do, when it comes to exercise and activity, just do the things that we can do or the things that we're good at. And we don't like to do the exercises or activities that we're not as good at. And oftentimes that's where a professional can help you. In the gym, a personal trainer can help you do the exercises that I wouldn't go and do on my own because I don't like them. So the R is risk factor assessment. So when it comes to your balance, there are certain risk factors that are going to make you more likely to have trouble with your balance. There's a lot of systems that work together to keep us upright. So all day long, our body is fighting against gravity to stay up. And in order to stay up, there's a lot of systems in our body that have to work together. And if any one of those systems are not working optimally, then you're going to be more likely to have problems with your balance. And so some of those systems are your muscular system. So if you have weakness in your legs, you're more likely to have a fall because your muscles in your legs aren't able to hold you up. A lot of times we have people who originally come to us for knee pain. And because they had knee pain, the muscles in that leg started to get weak. They favored it, they didn't use it as much, they didn't take the steps and keep those muscles strong. And then as a consequence of the knee pain causing the weakness, now all of a sudden they're having trouble with their balance because they're off balance from the one leg being weaker. So your muscle strength is important. Prescription medication is a risk. I don't know how many of you have, your prescription bottle. How many of those bottles on the side say may cause dizziness, may cause unbalance, may make you unsteady? It's probably the most common side effect of any prescription medication. So if you're taking a prescription medication that has a side effect such as that, you're going to be more likely to have trouble with your balance. Okay? And that's because it primarily affects you on a neurologic level. So it affects, the medication can affect your brain, that affects your ability to keep yourself up. Or the dizziness, which then if the room's spinning, obviously it's hard to stay up. Okay? Vision. So it's important that we have our vision checked on a regular basis, that we have the right prescription in our glasses, because if we're not able to see clearly, our brain can't get the message from our eyes as to what is upright. So the visual system plays a big part in maintaining our balance, because that's how our brain's getting the message as to where everything is and where we are in relationship to it. Problems with your feet or with the shoes that you're wearing. So a lot of times, if anybody has peripheral neuropathy, which is a numbness or a tingling in the feet, that's going to affect your balance, because that's another way your brain gets the message. So your feet touch the floor. That message goes, your feet feel where you are. They send the message to your brain as to where you are in space, and that you're standing on your feet. And you're flat on your feet, and you're not wobbly and moving all around. If you can't feel your feet as well, then your brain's not getting the right message about the fact that you're standing up, and isn't going to send the right messages to your body to keep yourself up. The footwear, you want flat, supportive shoes ideally, and that's just going to help you maintain, that's what hits the ground every time you take a step. So having the supportive shoes is going to help you maintain your balance. Out of those risk factors, there's obviously things that you can control, and there are things that we can't as well control. For example, the footwear. We can control the shoes that we wear for the most part, and that we're wearing something that's supportive and going to help us with our balance. Other things, you might take a medication that causes dizziness, but you absolutely have to take that medication. And in that case, you can't control the way that that's affecting your balance. Same thing with the peripheral neuropathy. If you have, nerve damage in your feet causing neuropathy, then that's not necessarily, sometimes medication can help, but not necessarily something you can change, like just changing your pair of shoes. The muscle strength is something you can change. That's something that you can do exercises. There are particular muscles that are especially important in maintaining strength for balance. But as far as the things you can't control, when you can't control something, there's two things that you need to do. First of all, you need to make sure all the other systems that you can control are working in your favor and are optimal. So if you have the neuropathy, you want to make sure you have the right shoes, because that's something you can control. Or if you have some weakness that you haven't yet addressed, then you want to make sure your vision is ideal, you have the right glasses, you have the right prescription, you're walking in well-lit spaces, so that you can make up for any areas that you're not as strong in. So first you want to make sure all the other systems you can control are working the best they can. The second is some of those things you can habituate to, such as dizziness. So if you're having dizziness because of medication, because of if you've had a fall and hit your head, sometimes that causes dizziness. If you've had a stroke or a mini stroke, sometimes that results in kind of chronic dizziness. That kind of dizziness your body can habituate to, which means you do activities that actually make you dizzy in a safe environment, so where somebody's there to help you and make sure you don't get hurt. And as you practice those, your brain starts to learn, because dizziness is a signal like pain, saying something's wrong, something's not right, right? So when we do those activities over and over in a safe environment, our body can learn, our brain can say, oh, well, that's not so bad. I'm really not in danger. You know, I got a little dizzy when I stood up that time, but nothing happened. I didn't fall on the floor. I didn't, pass out. And when your body gets used to that dizziness, kind of like a pain threshold, that dizziness threshold will come down, and your body won't respond with as much vertigo and dizziness. The other thing when it comes to dizziness that we need to mention is sometimes dizziness, if it's not medication or injury or illness related, it can be an inner ear problem. And our inner ear affects our equilibrium. And when there's little crystals inside of our ears that kind of float around, kind of like a level. So, a builder's level. The little, I don't know, what's it called that bobs around in the middle?
Bubble.
Yeah, the little bubble in the middle kind of tells you if you're straight or if you're off. And that's what those crystals do inside of that level in your ear. And so when you go this way, those crystals fall and they send the message to your body, okay, we're tilting over, we better come back this way. Or we're tilting this way, we better come back this way. And when those crystals aren't functioning correctly for a variety of reasons, you're not going to get that message to stay upright. And oftentimes that's what's causing dizziness. And in that case, there are treatments that can get those crystals back where they're supposed to be. And if that's something, in particular that somebody wants to get into, we can. If that's a problem that you think we have, we can talk about that a little bit more individually. But there is a treatment for that, okay? It might, if you've heard a doctor say that you have, it's called Bppv, benign paroxysmal Bppv, benign
Positional vertigo.
positional vertigo, yes, benign paroxysmal positional vertigo. Yes. So if you've ever heard that term, that's what it is. It's related to the inner ear. And there are treatments that can correct that problem, which significantly helps with the vertigo, the dizziness, and the balance. Okay? So those are all risk factors and things that you can control and things that maybe you can't control. The O in stronger is optimize your diet and supplementation. So this is everything that you're putting into your body is going to affect your ability to be strong and stable, to not have a lot of pain and inflammation in your body that's going to cause balance to be a problem. The big things one of the biggest things as we get older is protein, because in order to have strong muscles that help us balance and stay mobile we need protein to maintain our muscle. And that's one of the biggest things that we actually need to increase as we get older. And unfortunately, what it tends to happen is we tend to decrease it. So the protein, the omega-3 fatty acids, collagen that comes from meat and fish and things like that. That's a type of protein that helps build strong joints and tendons and ligaments and everything that we need to hold our body together to stay active. The N is notice changes. So these are changes could include changes in your vision, changes in sensation in your feet. If you start to feel some tingling or feeling like your feet go to sleep a little quicker than they used to, having any dizziness, having any pain symptoms, so back pain, hip pain, knee pain, foot pain is all going to affect our balance and feeling steady on our feet. Because if we have pain somewhere and something's not working correctly in the whole, system, we're not going to be able to stay upright. And a lot of people, especially with back pain, seems to be a big factor in balance. Kind of this whole middle area that needs to stay strong and stable. When people have back pain, a lot of times they start having trouble with their balance. So noticing changes. And like I talked about before in the self-assess, that when you can the earlier you can notice those changes, the sooner you can do something about it, as opposed to waiting till your back hurts and you can't get out of bed, and then you try to get out of bed and then you fall. Well, if you can catch it early, and you can prevent that whole cascade of problems occurring. G is get help and guidance. So you don't have to do all of the things, all of the assessment, all of the strengthening, balance, dizziness, habituation. You don't have to do it all on your own. There are a lot of resources, there are a lot of people who are trained to help you. And really one of the most important things I feel like as we get older is we need a healthcare team. So, having a strong healthcare team of people who can help you in various ways and hopefully work together to help you stay in your optimal health and activity and movement. The E is enhancing your strength and balance. So even if you're pretty good, you can usually always get better. So even though that I'm pretty strong, I still exercise because I want to maintain what I have or even get a little bit stronger, right? As my kids are getting bigger, and sometimes I have to scoop somebody up when they've fallen and scraped their knee, and so I need to get stronger proportional to how big my 6-year-old son is getting. So enhancing muscle strength, improving the way you move,